Good day, ma'am, sir. Now I will be performing the NGT insertion. So the purpose of this assessment is, this is a type of tube permits the patients receive nutrition through the tube feeding using the stomach as a natural receiver for food. And also, another purpose of the NGT tube may be to decompress or to drain unwanted fluid and air from the stomach. So for the equipment po, we have nasogastric tube, and stethoscope, water-soluble lubricant, normal saline solution or sterile water for the irrigation, and tongue blade irrigation set including the tuni, and also the flashlight, non-allergenic tape, tissues, glass of water with straw, topical anesthetic, it is optional, clamp, suction apparatus, bath towel or disposable pad, emesis basin, safety pin and the rubber band, non-sterile disposable gloves, additional PPE as indicated, tape measure or other measuring device, skin barrier, and lastly, pH paper. So for the assessment, assess the patency of the patient's nares by asking the patients to occlude one nostril and breathe normally through the other. And sir, pwede po bang patakpan po yung isang nurse po and hinga po kayo? Yan. Okay po. Sa other side din po. Okay po, thank you po sir. And also assess the patient's history for any recent facial trauma, polyps, blockage, or surgeries. Sir, nagkaroon po ba or na-accident po ba kayo or tumama po yung face niyo po? Ganun? Or bukol po sa ilong po? Okay po. And any surgery po wala kayo?
Hindi po.
Okay, thank you po. And patients with facial fractures or facial surgeries presents a higher risk for the misplacements of the tube into the brain. And also, now po, i-inspect ko yung abdomen niya for the distension and firmness. Sir, i-check po. Sige po. Okay, sir. And after ko naman po ma-inspect yung abdomen ni sir, is i-auscultate ko naman po for bowel sounds. Okay, sir. Now naman po is ipapalpate ko naman po yung abdomen ni sir for the distension and the tenderness. There's any pain po ba?
Wala.
Okay. And after po nun, if the abdomen is distended, consider the measure of the abdomen, girth at the umbilicus to establish a baseline. And next po, let's proceed na po tayo sa procedure. Now po is I will verify the medical order for the insertion of the tube. This is to ensure the patients receive for the correct treatment. Okay. And after that is perform hand hygiene and put on PPE if indicated. Hand hygiene and PPE is prevent the spread of the microorganism. PPE is also required based on the transmission precaution. So I will use the 70% solution of isopropyl alcohol. After that is identify the patient. So identify the patients is to ensure the right patients receive an intervention and help to prevent error. Good day, sir. I'm Miaka, Vijandre, student nurse from Laye University, Philippines po. Now po is I will be doing the NDT insertion na po. Please state your name, sir. And also I will check ID card. And after that is explain the procedure to the patients and provide rationale as to why the tube is needed. Discuss the associated discomfort that may be experienced and possible interventions that may allay as discomfort and any answered question asked needed. Sir nga po, ngayon po is perform ko nga po yung NDT insertion po. Lahat naman po ng procedure na gagawin natin is i-explain ko po sa inyo at parang yung NDT insertion po na ito ay way para po makakain, marami pa rin pong nutrients na pumasok sa katawan nyo, lalo na po ngayon at na-operahan po kayo. So, explanation of the facilities, patient cooperation, same patients, surveys reports that of all routine procedures, the insertions of the NGT tube is considered the most painful. Okay. Next is gather the equipment, including the selection of the appropriate NG tube. So, this provides for an ito po yun, organized approach to task. NG tubes should be and also should be radio fac. Okay, and also contain clearly visible markings for measurements and may have multiple parts for the aspiration. And next po is, now po is I will close the patient's bedside curtains or door. This is to provide the patient's privacy and also raise the bed in comfortable working position, usually elbow height of the caregiver, and also assist the patients to high Fowler's position and Fowler position and elevates the head of the bed in 45 degrees. If the patient is unable to maintain the upright positions, drape the chest with a bath towel or disposable pad and have the emesis basin and tissues handy. Okay, sir. Yan po. Please put it in the same Fowler position po. And after that po is, syempre, i-erase po natin the side rails. And after that is, close the curtain to provide the patient's privacy. And next po is, measure the distance to insert tube by placing the tip of the tube as the patient's nostril and extending the tip of the earlobe and then the tip of the side-point process. Mark tube with an indelible marker. So, measurement po is to ensure that the tube will be enough to enter the patient's stomach. Okay? And after that po is, I will put on drugs. after ko pong magsuot ng gloves is lubricate the tip of the tube po at least 2 to 4 centimeter po with the water-soluble lubricant and apply topical anesthetic to the nostril and oropharynx as appropriate po. Ito po yung tip po ng tube, tapos ito po yung namit natin. Personal lubricant water-based. For the rationale of this po is lubrication reduce the frictions and facilitates the passage of the tube into the stomach. Water-soluble lubricant po will not cause pneumonia. If tube is accidentally entered to the lungs, topical anesthetic reducing the discomfort and reducing discomfort, and consult the physician for an order for the topical anesthetic such as the Iducaine gel or the spray if needed po. So, after selecting the appropriate nostril of the patient, slightly flex against the pillow and gentle insert the tube into the nostril while directing the tube upward and backward along the floor of the nose. And also patients may gag when the tube is reaches pharynx and provide tissues for tearing, watering of the eyes, and offer comfort and reassure the patients. Sir, papasok ko na po, hinga pong malalim. So, when the pharynx is reaches, instruct the patients to touch the chest or encourage the patients to sip water through the straw or swallowing even if no fluids permitted. Advance tube in downward and backward directions when patients is swallow. Stop when the patient's breaths. If gagging and coughing persists, stop advancing the tube and check the placement of the tube with tongue blade and flashlight. If the tube is hurried, strengthen the tube and the attempt to advance again. Keep advancing tube until the pen marking is reached. And also po is do not use force and rotate the tube if it's meets resistance. So for the rationale of this is bringing the head of forward is helps to close the trachea and open the esophagus. Swallowing helps to advance the tube, causes the epiglottis to cover the opening of the trachea and helps to eliminate the gagging and coughing. And excessive coughing and gagging may occur if the tube has carried in the back of the throat, and forcing the tube may be injure mucous membrane. Okay lang po, sir. And after that is discontinue the procedure and remove tube if there are any signs of distress such as gasping, coughing, and cyanosis, and inability to speak or hum. This tube is in the airway if the patient shows sign of distress and cannot speak or hum. If after the attempts, nasogastric insertions is unsuccessful, and another is. Sir, pwede po ba kayo magsalita or mag-hum? Hindi naman po sir masakit.
Hindi naman.
Okay. And after that is, now po is isi-secure ko po siya gamit po nitong tape. Secure the tube para loosely to the nose or cheek until to determine the tube is the patient's stomach. So, yung securing po na yon with the tape is establishes for the tube by the positions of being determined. And also, gamitin ko po siya. And after po nyan is, I will attach the syringe to the end of the tube and aspirates a small amount of the stomach contains po. This tube is in stomach if the contents can be aspirated. pH of aspirate can then be tested to determine gastric placement. Ito po, mag-a-aspirate po tayo. After po na ma-aspirate is i-measure po yung na-aspirate in pH paper. pH paper fluid using, yun po, gamit po yung pH paper. And place a drop of the gastric secretion onto the pH paper or place the small amount in a plastic cup and dip on the pH paper po. Ito po yung pH paper. Tapos i-assume ko na po na ilalagay po ito sa machine para po malaman if I have any gastric po doon po sa na-aspirate po kay patient. Okay. And after po nun is current research demonstrate that the use of pH is predictive of the correct placement. The pH po also gastric contents is acidic, less than 5.5 if the patient is taking an acid inhibiting agent. The range may be 4.0 to 6.0. The pH of the intestinal fluid is 7.0 or the higher. The pH of the respiratory fluid is 6.0 or higher. The method will not effectively differentiate between intestinal fluid and pleural fluid. So, after po nun is i-visualize po natin kung yung na-aspirated po contents, checking for the color and also the consistency. So, gastric fluid can be green with the particles of white or brown or blood if present. So, intestinal aspirate also tends to look clear or is the straw colored to a deep golden yellow color. Also, intestinal aspirates may be greenish brown if the stains with bile, and also respiratory or tracheobronchial fluid is usually of white to tan and maybe tinged with mucus, and a small amount of the blood bigger fluid may be seen immediately after the ND insertion. So, obtain a radiograph X-ray of placement tube based on the facility policy. So, ang rationale po nito is the X-ray is considered the most reliable method identify the position of the ND tube. So, dito po sa X-ray na to is malalaman po if maganda po ba yung align ng ND tube at hindi po, at malaman ko po kung doon po talaga pumasok sa dapat pasukan ng ND tube at hindi po napunta sa any kind of organs like lungs. So, apply skin barrier to tip and end of the nose to dry. And also po, i-remove po yung lab and secure the tube commercially and prepare the device for the manufacturer's direction po. So, remove ko po yung labs, and after po mag-remove ng labs is isa-secure ko pa po to. So, cut a 4 piece of tape and split the bottom too. Or use the package of the nose tape for the ND tube, place and unsplit the end over the bridge of the patient nose. Ito po. Lumita po ako dito. And after that, after magupit, ito po is hatiin po sa may gitna. Okay. And after po nun, isi-secure ko pa po mabuti. Ito, and then okay po. And after that is wrap the split ends under the tubing and up and over onto the nose, and also be careful not to fold the tube too tightly against the nose. And after po nun is I will put on lab gloves. After ko po magput ng gloves is i-clamp ko po, clamp the tube and remove the syringe, cap the tube or attach tube to the suction according to the medical order. So, suction provides for the decompression of the stomach and drainage of the gastric contents. Secure po natin. And after po nun is measure the length of the exposed tube and enforce marking tube and nostril with and the ball. And as the Ask the patients to turn their head to the sides and opposite to the nostril. The tube is inserted, and also secure the tube of the patient's gown by using the rubber band, or the tape and the safety pin. So, okay, sir. Tapos isi-secure natin sa gilid po ng gown patient using the rubber band. And after po nun is assist with or provide oral hygiene 2 to 4 hours intervals, and lubricate the lip of the patient generously, and clean the nurse and lubricates as needed, and offer analgesic throat or anesthetic spray po sa throat irrigation if needed. So, option po natin ito po yun. Tapos, yung si patient. Pero after po nyan is oral hygiene po is ikikip po yung mouth clean, and most is promote comfort and reduce thirst. And also, last po is remove the equipment and return the patients to a position's comfort, and remove gloves, and also raise the side rail and lower the bed. Promotes patients' comfort and safety. Removing gloves and proper reduces the risk of infections, transmissions, and contaminations of the other items. So, ito po, remove na po natin lahat ng mga items. And after po nun is, remove po na po itong gloves ko. Pagtapos po mag-remove po is, pagpabak po natin si patients in comfort position. Okay lang po ba, sir? Okay lang po. And after po nun is raise the side heel on a lower bed. Okay? And after that is remove the additional PPE if used, and perform hand hygiene. So, with this alcohol, so removing the PPE properly is reduces the risk of the infections, transmissions, and contaminations of the other items, and hand hygiene is prevents transmission of the organism. So, lastly is document the procedure. That's all, ma'am. Thank you.